use program. The finding was necessary for some value, support and interest in the beginning of the lesson. And the sounds. Good sound, it's not a whole lot of more consequences of the performance. You are the power of the ground and the representative of the device which is that you are not one of them. In the robots, the policy with a local position, but the robots. Your opportunity for passing different things, important, important, application, research, and all of humanity. Over the years, the president has been observed and demonstrated an elegant presentation for this solution to the requirements of our national and diverse systems. Significantly, the pharmacy program of the Federal University program, who guides all year in year years. The Bachelor of Pharmacy program is still accredited for the Pharmacy Council of America and the Federal University. Robust comments have been said. The Federal Pharmacy and the program. That the approved by cities, realize and release. Furthermore, the one will have an induction in one alone for us to the Buddha, some cigarette, the key, is present and given to the power, 500, and all of them are attending. Now I have to go with what our power values. In the rest of the your role is irrelevant. As there is no comments for, please embrace the computer. You are important in where you are others. And if the particular, you feel out, you feel carry the wings of someone else and go. Please remember, meditation was not it can go. Say rules, be adaptable, and embrace the continuous learning that demands the decisions. Please ensure that you embrace the ever-changing landscape of learning demands. And therefore, all the rules for the practice work and do that system of university wherever you find it today and follow the rules. Very specifically, I would like to reiterate some of the points that have been already covered. All research and development of our university has continued to support the development of the policy in my research and development. The college also has a collaboration with several key agencies within and outside the country. And the latest is that the solar university program, where the linkage is for research. Our student exchange, linkages, and training. Additionally, the university are fulfilling promise of establishing talented manufacturing department, university of the Department of Pharmacy, and pharmaceutical technology in the College of Pharmacy. This facility is designed The whole of the government are going to see ourselves. And it also needs immediate care environment of the university and our host community. There is a material release. The university are also giving our community line for the provision of accessible to the technical and readiness. This will further strengthen our teaching and research. And we also into that accessibility needs both the people and other healthcare institutions in the UC. Also, several members of staff and joining the university sponsor program for postgraduate formation for ourselves between the government and also the community. Very distinguished and everything. Permit me to use opportunities now to express our gratitude for the learning of honorable child, the residents, the word, Good beautiful fight, making the Spanish land from the university in 1999, also by the establishment of the first Thomas College in the private university in the Nigerian. Now, he was part of family for the congregation. I think is the implication of that person before that giving rise to the opportunity of this so-called induction. To thank God for the matter, to thank God for the sponsor, and thank God for his determination to ensure that the healthcare program in this country not only is for the next year in the mind of the personal society. Let me thank our parents and parents who have sacrificed a lot, their time, their treasure, their talent to ensure that our notice today go to the private social place of God and are here to be for nothing. The journey is not easy, but I like to assure our parents and parents from what we see this morning, very clear that your efforts have not been in vain. Please, can we give our parents and children a round of applause? The concern, the anxiety, the show that the complete similar and related to the please honor and thank you very much. The leaders, the follow the farmers. The acceleration and the applause of the team affected the picture of the new following the farmers in the further of this. It was a demonstration of the acceptability and the hard work and dedication and devotion that giving the college of China. I was telling the registrar on the council that it is one thing that has worked well with the staff and the student. And I've never given any problem in the last 6 years. In the same way, it takes two to tango. I must also thank the staff and the students that have passed through during this tenure as this for providing support and what we describe as family collaboration. The College of Pharmacy is just like a family. The university is very proud of all the staff and students. And those of you that are leading us now, please carry on this banner of partnership and collaboration. You need it. Dean, I thank you the assigned members of staff of the College of Pharmacy. It is not surprising, therefore, that they have about 80, almost more than 85% of members of staff that have had a doctorate degree in pharmacy. Congratulations. Very distinguished ladies and gentlemen, in closing, I urge the introduced to cultivate a sense of purpose in your chosen profession. Be not just dispensers of medicine, no, but be advocates for premium health and well-being of mankind. Congratulations on reaching this milestone. And I look forward to witnessing the positive transformation you bring to the field of pharmacy as you go into the global market. My best wishes as you journey ahead. God bless the area university. Thank you.
Please round of applause for the Vice Chancellor. Please continue rallying. Thank you very much, Vice Chancellor, sir, for this wonderful remarks that you did just now. Permit me now to recognize the presence of the special guest of honor for today's event, Francis Mrs. Felicia Orango, Oda Service. We thank you in a special way for being here today, and we welcome you to our very wonderful university. I also want to recognize the presence of Francis Solomon, the representing chairman of the Pharmacy Council of Nigeria and Workplace. We have Francis Chris Osagede, chairman, very limited and Workplace. We now Francis B, managing director of Operation Pharmacy and Stores, Anapia Springs. We have Francis Aziz, South Zone Director, Pharmacy Council of Nigeria, Anapia Springs. We also have here the Student Representation Council, led by the Mayor of the University. For Modern with Anapia Springs. In due time, we will recognize the reasons people that have been trained here today. But moving on quickly, at this point, I invite the University Orator and the Dean College of Law, Professor George Usemoa, for the citation of the guest speaker. Thank you.
Chancellor, who is also the chairman of the division. Permit me to specially invite our guest speaker, Dr. Francis Paul, Lord standing for the citation. Citation on Dr. Francis Paul Sophie, enabling PHF, FPSN, FPC Farm, FAN Farm, Chairman, Impact Farms Limited, our very respected guest lecturer on the occasion of the 13th induction to oath-taking ceremony for the 2022-2023 sexual pharmacy graduates, according to the 10th of January 2004 at our main auditorium. Mr. Chairman, very distinguished ladies and gentlemen, Dr. Pharmacist Paul Osobu, inevitably
FERI, Pharmaceutical Society of Nigeria, PSN, FERI, West Africa College of Pharmacy, FERI, Nigeria Academy of Pharmacy, member Federation of International Pharmacists, and of course, a Harris FERI is a household name in the pharmaceutical world. In the world of Don Moody, things work out best for those who make it best of how things work. Pharmacist enabling is one person who made the best of how things work. No wonder distinguished ladies and gentlemen, he described among his friends and colleagues as one who has served the most in the service of pharmaceutical development in Nigeria. Distinguished ladies and gentlemen, pharmacist Enebeli was born in Kaduna on the 2nd of April 1953. He obtained his first primary school education at St. Gregory Catholic Primary School in Kaduna between 1959 to 1965. He also attended St. Columba's Grammar School, Accra, and obtained West Africa School Certificate in Flying Colors. Dr. Pharmacist Enebeli had a stint at Government College in Mary, but due to the Civil War, he could not sit for an exam. But not deterred at all, he was admitted for the B.Pharm degree in 1971. And by 1976, he obtained a Bachelor of Pharm degree from the prestigious University of Benin. Can we clap for him with that? Alfred Almond Mutapa once said, the monument of the great man is not of granite or marble or bronze. It consists of his goodness, his deeds, his love, and his compassion. Indeed, distinguished ladies and gentlemen, the qualities celebrated above resonate profoundly in pharmacist Enebeli as a great man of passion. Very distinguished ladies and gentlemen, soon after pharmacist Enebeli completed his university education and internship, he worked as a medical representative in sharing African Nigerian Limited and steadily rose to become a product manager between 1978 to 1982. Thereafter, very distinguished and gentlemen, he became the superintendent pharmacist and the chairman of Alpha Pharmacies from 1982 to date. He is also the chairman, New High Pharma Limited, and also the chairman, Frontline Insurance Broker. Mr. Chairman, sir, very distinguished and gentlemen, Dr. Pharmacist Enebeli, no doubt is new, humble, and an accomplished pharmacist who has served most for pharmaceutical development in Nigeria. Among your services are Chairman of Elder Program of Pharmaceutical Society of Nigeria, Delta State Chapter, Chairman of Political and Legislative Action Committee of Pharmaceutical Society, Chairman in Benin, Iconic Pharmacy Forum, Pioneer Chairman, Make and Breaker Award for Excellence in Pharmacy. I can go on and on. In the same vein, distinguished ladies and gentlemen, this great man of just talent, as a worthy Rotarian, who is the president of the Rotary Club of Makari, highly trained in forward next of Rotary International, has continued to render quality services to the Ghana, the University of Benin, to the nation, and of course to the community. And these services have earned him various honors and awards, among which are one, from Paul, the Enebeli Secretary of Pharmaceutical Association of Nigeria today, the Benin University, 2023. Pillar of Support Award from the University of Benin Alumni Association in Asaba Brand, 2022. Presidential Award for Distinguished Service as Chairman, Political and Legislative Action Committee, 2021. Conferred with the title of NCNA by the Catholic Women of the Asaba Region, 2021. Life member, Lagos Country Club, 2019. Excellent Service Award for contribution to the Alumni Association from University of Benin Alumni Association as about 2018. Special commemorating plaque for his contribution to the growth of Unibe by His Excellency Dr. Samuel Obenita, 2016. Excellence in Leadership Award from Nigeria Association of Hospital and Administrative Pharmacy, 2014, to many of you. Above all these distinguished ladies and gentlemen, Dr. Promise is a Paul-Harris Fellow of Rotary International. I can continue endlessly on his award tonight. Very distinguished ladies and gentlemen, pharmacists in Nigeria have delivered many public lectures, just as I'm going to do today, to the admiration of all, and among these lectures include pharmacists' preparedness for tomorrow's expanding growth in healthcare, that's 2023, graduation and oath-taking ceremony. Guest speaker, opening jubilee anniversary of Faculty of Pharmacy, University of Benin, 2021. Keynote address ethical pharmacy practice in Nigeria, Nigeria Association of General Practice Pharmacists, 1995. 1993, drug distribution and control, National Executive Committee, Pharmaceutical Society of Nigeria, to mention of you. Mr. Chairman, distinguished ladies and gentlemen, Dr. Pharmacist Paul Usopenebe is well established in every aspect of life. A blessed family man, an accomplished pharmacist, a business of son, and above all, a dignified hotel whose core value is service and music. Permitting me therefore, Mr. Chairman, and our very distinguished ladies and gentlemen, to invite this self-generian, still looking for this to the podium who want to know how to do that. Thank you, sir.
The chairman of the commission, then my brother, Professor Ukechukwu, the registrar of the Pharmacists Council of Nigeria, my dear colleague, Ibrahim Abashevo, FPSN, FMA Farm. Permit me to rest on already established protocols. I want to thank the university for inviting me to give this keynote address at this very special occasion of induction of this great university. I used to enjoy going to Lagos by road. And then every time I passed here, this road between Benin and Ore, I've always looked forward to be in this university. I've really not had that opportunity. But today I've come here and the sea is building. I want to commend the Chancellor of this university, Sir Gabriel Osawaru Ibenedio, CON CFR, a man I have very great respect for. When I was president of the University of Benin Alumni Association, I had the singular pleasure of being hosted by him in his palatial home at the GRA Benin City.
This is a man of class, a man of vision. I dare say that people who were growing up were told that a tree cannot make a forest. But talking seriously, Sir Gabriel Igbenidion has totally put that saying to falsehood, because a tree has to make a forest. I want to urge you all, this is a university. Try and make a research, more research. Any society, any clan that has one individual has something to do with property. Because really, they are true that the tree shall move in forest. I have been asked that my address will be for just 30 minutes. So I will try to make it as brief as possible, but direct to the point. And the topic that I'm supposed to talk with too is optimization of pharmacy services in Nigerian healthcare system, a hyper collaborative approach. That is the topic. Well, in taking this topic up, we have decided to first look at the structure of the Nigerian healthcare system today. In Nigeria today, we operate a three-tier healthcare system. The primary, the secondary, primary healthcare provides basic medical services to villages and districts managed by local government areas. It enables health systems to support individual health needs, from health promotion to disease prevention and water abuse. While the secondary health care is delivered at the general hospitals in our towns and along states, and each is deployed to cover several local governments. They offer outpatient consultation and inpatient services, including emergency care, while the tertiary healthcare system is for highly specialized medical care, usually over an extended period of time, that involves advanced and complex procedures and treatments performed by medical experts or specialists in state-of-the-art facilities all over Nigeria. The Nigerian healthcare system has largely been described as underdeveloped because of lack of necessary facilities, lack of health centers, scarcity of health workers, and modern medical equipment, so that it can function optimally. It's even worsened by the fact that there's a lot of corruption. There's also a lot of interprofessional disagreement and conflict. In the healthcare sector, there's, like I said, not much to be very proud about. In 2001, all the governments of Africa came to Abuja and had what they call the Abuja Declaration, which said that the government should yearly budget 15% of its budget to health. This has always been in default since the Nigerian state came to be. We have always had budgets that have been falling far short of this. Only recently, this year's budget is only not more than 6%. And usually when you have a shortfall, it then means that you're not able to meet the high standards that are expected for healthcare delivery systems all over the world. Currently, the World Health Organization rates Nigeria as one of the last 4 countries in terms of healthcare delivery. Now let's consider the role of pharmacists in the healthcare delivery system. Pharmacists are cornerstone of the Nigerian healthcare evolution. Pharmacists are among the most accessible healthcare providers, and their role has expanded to include a wide range of services for individual and community health. The functions of pharmacists are presently underutilized, and their potential roles in patient care can be seen as a missed opportunity to improve the healthcare system of Nigeria. Pharmacists are involved in building the strongest healthcare system around the world. In Nigeria, all the various fields of pharmacy have a great impact on the health system, thereby improving healthcare across the nation. The role of pharmacy has evolved significantly over the last few decades. It used to be just purely dispensing in hospitals, but now we've imbibed patient care, and we also go on to take administrative tasks and other public health functions. Pharmaceutical care aims to provide a responsible and conscious drug therapy within an integrated health system to achieve optimal medication outcomes and increase patient satisfaction. That is what pharmaceutical care is all about. Thereby improving patient quality of life as well as overall delivery of healthcare to the public. Thus, it can be stated without equivocation that pharmacists play an inestimable role in the healthcare system, not only in advanced science, but also here in Nigeria. Pharmaceutical care services in hospitals promote optimal medicine utilization, cost-effective prescribing and medication safety by optimizing therapy, promoting rational prescribing, lowering inappropriate medicine usage, and preventing medication-related harms. Improved hospital pharmacy activities have also contributed to improved patient outcomes. Hospital pharmacies are also engaged in rendering of drug information services to patients, physicians, nurses, and other members of the healthcare team. They are also engaged in pharmacovigilance activities in collaboration with NAFDAC. Clinical pharmacy programs and community engagement. Nigeria established clinical pharmacy programs in response to the hospital need for pharmaceutical care. The introduction of Doctor of Pharmacy Foundation, which I had the pleasure to move the motion for its adoption in Council of the Pharmaceutical Society of Nigeria, was pioneered by the University of Benin mid-90s and has helped immensely in enlisting more clinically rated pharmacists into the health system by working with physicians in delivering safe and quality medications in order to achieve better health care for all. Pharmacists in Nigeria play a critical role in pharmaceutical procurement, putting them in a unique position to ensure that the most cost-effective drugs are purchased in the most appropriate quantities from reputable suppliers in line with the essential medicine list and delivered where and when needed, while promoting rational drug use. By providing appropriate advice, pharmacists can reduce purchases of unnecessary and expensive drugs. Pharmacists in the community play essential roles in healthcare as they are the initial point of contact and they attend to patients seeking assistance on common health concerns. They also provide self-management guidance for minor disease and engage in referral to other healthcare providers from time to time. In the same vein, these pharmacies may be the patient's last line of contact for commencing any treatment. And they come with their prescriptions. To fill them, you have to get the right information. These pharmacies may be the patient's last point of contact before commencing any treatment. So they play an important role in checking for drug allergies, reinforcing messages about proper medication use, ensuring adequate monitoring, providing guidance on adverse drug effects and reactions, drug interactions, drug-food interactions, and improving medication adherence. Community pharmacies play an important role in optimizing medicine usage in the community to help achieve quality medicine use. It is heartwarming that arising from the last COVID-19 pandemic, community pharmacists in Nigeria have been granted approval to serve as vaccination centers for COVID vaccine. These are the case in virtually every part of the world. As a matter of fact, if you attend conferences outside this part of the world, you will see a lot of training going on within the conference for pharmacists to get themselves well acquainted with vaccination. The role of industrial pharmacists. Industrial pharmacists also contribute significantly to the health system by engaging in research leading to manufacture of new drugs. They also supply these drugs to public and private hospitals as well as community pharmacies, thereby ensuring continuous access to high-quality medicines by patients. Over the years, numerous pharmaceutical companies have been founded in Nigeria, with the current estimate put at almost 150. They have ensured the efficient manufacture of pharmaceuticals that aid in the prevention and treatment of various health problems and the provision of drugs that improve the quality of life of the Nigerian people. Pharmacists play a major role in checking medication errors, which are now ranked 7 amongst ailments after cancer and heart disease in developed countries, with standard healthcare services such as the United States. In Nigeria, laws guiding medication handling are often neglected, and this could lead to drug therapy problems. The continued existence of open drug markets in Nigeria has compounded the chaotic drug distribution system in the country, and these are very dangerous effects and consequences as far as the progress of phase of fortified fake and substandard medicines are concerned. Pharmacodynamics. This is indeed a new area, and a lot of work is being done to ensure that the development of pharmacogenomics, which is the study of how an individual's genetic makeup can affect the person's response to medicine. The use of genetic testing and genetics optimizes medicine selection and dosage, IT and AI. This lecture will not be complete without mentioning the impacts of information technology and artificial intelligence as on the health systems of countries. Advances in IT are having a major impact on practice. One example is the development of electronic prescriptions, which ensure greater reliability, safety in repeated prescriptions in chronic illnesses, and ameliorates the sharing or dispensing information between community and hospital pharmacies and between the communities that are not contiguous. Progress in IT combined with AI is opening new areas in telemedicine and teledispensing. These are many ways that have been involved in other more civilized clients to make patients the center of our therapy for the medical team. Telemedicine is not only driven by such developments, but also by decisions on policy and healthcare governance based on the relative responsibilities and cost effectiveness of different professionals. Prescribing, rectification of prescriptions, and care transfer. Approximately 1 in 30 patients are subject to medication harm that could be avoided. And in 25% of these cases, this harm could be very threatening. Pharmacists screening together with other methods who help in the detecting of this problem. In hospital pharmacy, the frequent clinical incident is medical-related error. These errors often occur during admission and discharge of patients, raising questions about the interaction of the hospital pharmacist and other hospital staff. Antibacterial stewardship. Antibacterial resistance is brought about by inappropriate prescribing, especially in primary care. Sales, use of antibiotics outside the healthcare system, and insufficient investment in development of new antibiotics. It's even going to be worse now when with the cost of antibiotics which is hitting the roof. It's becoming very difficult to even buy simple antibiotics that will take care of the therapies. I understand that augmenting now is about 50,000 per pack. And so there's a need for us to get ourselves prepared to ensure that antibiotics are given only by prescription from an expert. It is a major problem in primary care where viruses cause most infections. Here, pharmacists play a decisive role in programs to promote antimicrobial stewardship, which include optimizing therapy by recommending an appropriate medicine regime, duration of therapy, and dosage route. And also monitoring of therapy and instructing healthcare workers and patients on the appropriate use of antibiotics. Pharmacists also play a role in the use of antibiotics outside the healthcare system. For instance, in the case of unlawful dispensing of prescription-only medicines. I just sit back a little. Public health. Another role of pharmacists in healthcare is in public health. The 5 or 6 year degree course gives pharmacists in-depth knowledge of diseases and their therapies. In the context of these increasing healthcare budgets, governing agencies are looking at the cost efficiency of the different actors in the global healthcare scheme and the ways to put pharmacy competencies in better economic field. Thus, the role of pharmacists in governmental policies are changing with greater involvement in the general health of the population. Examples of these are the roles of pharmacists play in smoking cessation, HIV/AIDS monitoring, and provision of medicine, as well as other infectious diseases. Pharmaceutical care practice among community pharmacists covers such areas as management of acute situations such as chlamydia testing and emergency contraception, and chronic diseases such as diabetes, hypertension, HIV/AIDS, hyperlipidemia, asthma, kidney disease, urinary tract infection, and depression. Only recently, the FIP has also included the issue of loneliness as part of those rules. Don't think like what the pharmacist is very vital. The role of pharmacists in fighting infection diseases was highlighted by the recent COVID-19 pandemic. The importance of pharmacists is underlined by the rapid response measures needed to mitigate the spread and impact of COVID-19. Pharmacists' roles involve both their substance-oriented and patient-oriented competencies, organizing of the supply and storage of heat-labile vaccines, distribution and delivery of vaccines, reconstitution of vaccine preparation, patient education, as well as actual vaccination and provision of prescribed medication. And include also production of personal protective equipment and so on. The impact of the COVID-19 pandemic on practice is judged by the many to be the major milestone in the recent history of pharmacy. The impact of COVID-19 pandemic on practice is judged by many to be a major milestone in the recent history of pharmacy. Pharmacists are fully incorporated and involved in the provision of pharmaceutical care services in the health system. Evidence from within and outside the country to indicate that pharmacists-led care interventions were highly effective in long-term disease prevention, medication, and therapy. Having gone through all areas of capability of the pharmacists, it's important now that we look at the need for collaboration. Provision of optimal health care involves the participation of diverse team members consisting of specialized healthcare professionals, pharmacists, medical doctors, laboratory scientists, nurses, therapists, and others. Other staff of the care facility, patients, and families. Globally, interdisciplinary healthcare teamwork is increasingly favored as a strategy to improve service delivery. Various studies have shown that effective teamwork in healthcare service delivery can significantly reduce medical errors and unnecessary risks, improve efficiency, improve health outcomes and quality of care, enhance patient safety, improve patient satisfaction, reduce patient mobility, reduce workload, and also increase job satisfaction and retention, and strengthen health system. Effective healthcare teamwork is beneficial to the patient, team members, the team itself, the health facility, the society at large, and is globally recognized as an essential tool for building and sustaining an optimal healthcare system. The Nigerian healthcare system sector national healthcare sector is facing increasingly complex challenges arising from several factors. They include lack of teamwork, which is the pain of weak and ineffective healthcare systems in many countries, including Nigeria. Physician dominance and claim of ownership of patients. Allied professionals, attitude and ignorance of pharmacist's role. Salary disparity, poor communication and effective leadership style, among others, have been identified as impediments to teamwork. To solve the healthcare challenges, there is a need to move from traditional team effectiveness to building team skills in each individual. That brings us to the issue of hyper collaboration. Hyper collaboration has emerged as a response to the need to solve problems and challenges bigger than any one organization or team. Success comes from building individuals' ability to be great team members rather than the more traditional approach that focuses on the team as a whole. Hyper collaboration is the approach of working innovatively with partners beyond the walls of your own organization and industry in the process of creating an ecosystem. Technology from different domains is usually an important part of the work itself. Data is freely shared, freely and widely shared, and made available to all collaborators. And there are multiple levels and means of collaboration. Collaboration exists between large numbers of partners, including non-obvious partners. Players and relationships evolve rapidly. The hyper collaboration mindset is that someone somewhere has probably figured out how to meet your need or solve a challenge, but it's unlikely that this person works on your team or even in your hospital or industry. That means that when we are facing large challenges, just like what happened in COVID-19, we need to work collaboratively with often unexpected partners, leveraging technology effectively to create innovation ecosystem that come together to deliver solutions that we never will have thought of. And that is why we talk so glowingly about the good parts of COVID-19. In the sense that COVID-19 was produced in less than about 10 months. Ordinarily, this takes as far as much as 10 years. And this was because there was synergy, there was hyper collaboration. And so the world at large is trying to use that framework to ensure that all health teams, all members of the health team work collaboratively to ensure that the patient gets the best from the team. It is obvious now that no one can say, I own the team. That on the patient. The patient is now for every member of the team. And that should be the focus. In nature, ecosystems are dynamic. If one element changes, other elements in the ecosystem changes in order to survive. Teams today operate like ecosystems, shifting and changing frequently in their membership as well as their goals. In a hyper-collaborative environment, this traditional approach to team effectiveness don't apply. Instead, team effectiveness is best achieved by building team skills in each individual. What this is saying is that you don't expect that everybody will only accept the team approach. So we should be able to build team skills on individuals so that when they get into the team, they now appreciate their respective goals. Fast-moving work environment need people who know how to team, people who have the skills and flexibility to act in moments of potential collaboration when and where they appear. The characteristics of effective teams have not changed, just the way people go about it. We still need teams that have trust, collaboration, clarity of role, shared vision. But the question to ask now is, what is the role of each individual in creating that reality for the teams that they are part of? And there are three major skills that we need to hone to ensure that there is this hyper collaboration. They include one, awareness. Awareness in teaming is the recognition of the importance of interdependence with others for accomplishing the team's goals. Individuals with activated awareness approach their team membership intentionally, looking for interconnection and ways that they can both contribute to and receive benefit from the team. Two, personal leadership. Given the dynamic nature of teams, individuals are most effective when they lead themselves in some key areas that include emotional competence, leading above planning, and time management. The issue about emotional competence is key because when you are teaming, there could be quarrel disagreements, but a man with the right emotional competence is able to rally the troops together so that we don't lose the focus of what the goal is. Needless to say that time management is very important. We should be able to ensure that we don't become the core and the wheel of progress by not being time conscious. Team acquisition. With the dynamic nature of teams operating in a hyper collaborating world, it is inefficient to depend on a team leader. So there was somebody who can, an external facility, diagnose and address team challenges that are their rights. If instead every team member has a basic ability to diagnose team challenges. These three teaming skills are cyclical and self-reinforcing. And individuals who know themselves as well as the impact they have on others and are aware of the strengths, dreams, and values of those around them to set up for effective personal leadership. An overview of pharmacists, physician collaboration. Collaboration in health services in Nigeria is that interprofessional collaboration between physicians and pharmacists dates back to the pre-independence era, when the medical and pharmaceutical professions were seen as a single entity, but it was not evidence-based. The paradigm shift in pharmacy practice from the traditional mode of dispensing to moving into this mode of pharmaceutical care, which evolved from USA in the early 90s, ensure that pharmacists take responsibility for medication care they provide to the patient. And this ensures collaboration with other healthcare personnel, and most importantly, with the physicians to ensure rational drug use. Potential impact of hyper collaboration in health system. In hyper collaborative environments, traditional approaches to team effectiveness do not apply. Instead, team effectiveness is best achieved by building teaming skills, and everyone has already mentioned. The impact of pharmacists in primary health care have been several studies. Pharmacist interventions involve medication delivered collaboratively with the general practitioner. These interventions lead to significant improvements in blood pressure and cholesterol level. Now, competencies of pharmaceutical practice will further develop within the context of an interactive global healthcare complex responsibilities. One aspect is the creation of healthcare centers grouping the activities of pharmacists and other professionals, doctors, nurses, and others, to allow for in-depth examination and management of therapy with a reduction of the multiplication of visits to different healthcare specialists, of which separated located. Conclusion. Pharmacists continue to play an important role in strengthening of the healthcare system in Nigeria. Training and retraining of pharmacists should be continuously emphasized so that we do not lose our value and for us to achieve the greatest level of healthcare in the country. Possession of the fellowship for the West African Postgraduate College of Pharmacy and Doctor of Pharmacy and other postgraduate qualifications should be vigorously pursued. In this regard, I would like to call on the federal government to immediately remove all obstacles to the implementation of the pharmacist consultancy cadre circular as approved by the government in 2020 to enable the Nigerian people benefit from the services of consultant pharmacists. There is urgent need for pharmacists to take their rightful place in the healthcare sector in Nigeria and to make maximum use of our training, knowledge, skill, and competencies. Bearing in mind the complex nature of the healthcare system in Nigeria, the diverse professional groups and inclinations, there is need for us as pharmacists to adopt the hyper-collaborative approach to enable us to continue to make great impact in the health system, thereby improving healthcare across the nation. Before rounding up this presentation, let me mention a few areas that call for immediate government intervention, and this should be within the shortest possible time. It has been observed that the headship of tertiary health institutions have been dominated for long by a particular group of professionals, in this case, medical doctors. The same practice obtains at post-secondary and primary care hospitals. In my opinion, this should not be the case any longer. You do not need to possess a high dose of clinical skill to manage that institution. In the past, we used to have hospital administrators who used to function as chief executives as in public hospitals and clinics. This pattern should be restored. These hospitals at that time were ramped up and delivered on their self-objectives. I'm also using this opportunity to call for a liberalization of headship of tertiary health institutions in Nigeria. The office should be open to the various professionals in the healthcare sector, pharmacists, nurses, physicians, and others, and not just the exclusive preserve of one profession. Similarly, the practice of ensuring that it goes around to cascade to both the secondary and the primary care level. In the same vein, the appointment of Minister of Health and Minister of State for Health should be from the various health professionals that make up the health ministry, and not just for one particular group. If we truly desire to achieve the optimum healthcare delivery in Nigeria, which is even the focus of hyper collaboration. Let me use the opportunity to also congratulate the graduates and their proud parents and guardians on these milestone achievements. I want to let you know that pharmacy is a very honorable, respected, and profitable profession. And I don't think that you have any cause for concern for your words. I note with joy that 3 of the graduates made it first class. This is no mean feat. In our own time, if you made a second class offer, you celebrated. So we are happy and delighted that the Graduands are showing the way. May God bless the neighborhood. I therefore, on behalf of my friends, at the appropriate time to donate the sum of 100,000 naira each to the graduates who made first class. As a form of encouragement for them to achieve even greater heights. I would like to end this address by asking that we have said so many things about pharmacy and pharmacy and pharmacy. When you go to the outside world, you are indeed not likely to just be a pharmacist. You will be faced with the challenges of the greater world. And so I want to give you a few advice. There are 7 habits that make a successful life. And I want you to listen quietly. We just spoke, what we just delivered is all science. I'm sure most of them you already know. But this is life itself. Life is not as easy. Nigeria is one of the best countries to live in. Did you hear me? Nigeria, despite all the hullabaloo, Nigeria is still the best, one of the best countries to live in. We are very endowed, both women and capital. What is that like? It's leadership. And leadership has nothing to do with whether you're a pharmacist or an architect or a lawyer. You must find the best way as you trudge along to develop leadership. So I want to give you 7 habits. 1, you should be a learner for life. Did you hear me? You should be a learner for life. 2, you have a good network. If you have a good network, your network is directly proportional to your network. 3, you should be an avid reader. Read anything. They say knowledge is. Thank you. 4, set goals for yourself every day. Set goals for yourself every day. Don't give room for procrastination. 5, join the 4 a.m. club. Join the 4 a.m. club. What does that mean? Wake up at least early in the morning. That's when your brain is fresher. If you forget anything, write it down by your bedside, because you may not remember it again. Inspiration comes very early in the morning. 6, keep a healthy lifestyle. This is very critical. Diabetes, hypertension, hyperlipidemia, and all that. There are things that you can curtail by living a lifestyle from now. Because when you get to my age, it may be too late. to keep the healthy lifestyle. And 7, be a good manager of time. They say time waits for no man. So be a very good manager of time. I would like to end this address by quoting from an Irish prayer. And it says, may your days be many and your troubles be few. May all your blessings descend upon you. May peace be within you. And may your heart be strong. And may you find what you are seeking wherever you roam. I thank you for this opportunity. May God bless Graduands University. May God bless your chancellor. And indeed, may God bless the Federal Republic of Nigeria. Thank you, sir. Please, another round of applause for our very distinguished guest speaker. Please continue clapping until he takes his seat. Thank you very much. Please now invite the chairman from our Pharmaceutical Society of Nigeria, Edo State Branch, Pharmacist Dovi Society, and other there to the podium, please. Please, can you help us locate him and bring him up to the podium, please? Bring him up to the stage, please. Okay. All right, so he will soon join the guests as a stage. We have to recognize at this point the presence of Dr. Osako Obiasos, the Edo State Coordinator, Young Pharmacists Group. And of course, for him, please. We also want to recognize the presence of Dr. Wachuku Idemele, the Professor of the Managing Director of Sagbe Nigeria Limited. An applause for him somewhere at the back. Moving on quickly now, may I invite the Registrar, Pharmacy Council of Nigeria, Pharmacist Ibrahim Ahmed, for his an applause, please. The chairman, the vice chancellor, and management members of the Individual University of Kada. Our guest speaker for today, our own pharmacist, Dr. Paul Nebele. Our special guest of honor, retired permanent secretary with the Edo State Minister of Health, Pharmacist Felicia Correa Mondaro. These were the second votes we had in the Governing Council of the PC. Let me stop here because of time, and I appreciate all the distinguished guests here. But before I proceed, I want to announce to the Vice Chancellor and the university community that this induction ceremony is unique and special for me because I have my children also being inducted today to the pharmacy profession. It is for me a special day. I will give all glory to God for this. It is my pleasure to felicitate the university community, the faculty of pharmacy, and the graduates on this occasion of fresh induction for all-taking ceremony for 101 graduates of the Bachelor of Pharmacy degree of the Faculty of Pharmacy in the University of Ghana. Let me at this point appreciate the vision of the Chancellor, the SMA of the Union, for the vision to have established this university and for having as part of the programs of the university a faculty of pharmacy. And of course, for even naming the faculty of pharmacy after our late Dr. Dora Akinyi or Professor Dora Akinyi, I'm sure that is done to serve as an inspiration for people that will pass through this faculty, that ahead of you lie a lot of, and passing through this place prepare you for the greater challenges in life. Our inductees have toiled over the years with determination and resilience to attain the enviable settings of today. Let me appreciate the parents and guardians who have supported the graduates throughout the course of their studies, while extending thanksgiving to God Almighty for His sustained guidance and protection over the inductees throughout their academic pursuit. Distinguished ladies and gentlemen, these young men and ladies gathered here today have just completed the first phase of training as pharmacists, professionals indeed, and are set to be inducted into the noble profession of pharmacy and it's one of the cardinal requirements of the pharmacy law as prescribed by the law establishing the Pharmacy Council of Nigeria. As we take the oath today and become inducted members of the pharmacy profession, I urge you to maintain high ethical standards and leadership qualities as prescribed by the Pharmacy Council of Nigeria, as well as endeavor to be working professionals for the achievement of excellence in the provision of quality pharmaceutical services for sustainable healthcare delivery in Nigeria. The second phase of your pharmacy training will start immediately with the 1-year statutory intensive program, which is compulsory for all pharmacists trained in Nigeria, as well as those who train abroad, but who have not been fully registered in the country where they are trained. I want to advise you to take the period very seriously. It is a period for the success of your practice as a pharmacist. Let me also say that it is expected of you to undertake the internship program only in PCN accredited centers, that is institutions, and we have many of them. I wish to inform you that you are expected to pass the pre-registration examination after your internship. And let me pause here to assure you that you don't need to go through any stress to pass that exam, because essentially the questions you see in that exam are experiences that you acquired during the internship training. What that comes to tell you is that you must take your internship training very seriously. Everything you learn will, of course, be part of what will be tested on. It's, of course, one of those things that is expected to shape you for the future of your practice as a pharmacist. What we do by administering this exam, of course, it's also in line with global best practices, not just in Nigeria. Now, as pharmacists, you are expected to get yourselves acquainted with the code of ethics, professional ethics, which describe your professional and moral responsibility to the patients, the pharmacists, colleagues, other healthcare professionals, your employers, and the general public, among others.
strict compliance with the code of ethics is indispensable for the practice of pharmacy. But I must also state that as you become registered members of the pharmacy profession, be rest assured that as pharmacists, you have great opportunities and potential to harness wrong. What we want from you is to keep the guidance of your senior who will mentor you, as you have so many opportunities to pick from. You can choose to work in the hospital, you can choose to be in the academy, you can choose to be in the academic department, you can also choose to be in administration as our retired permanent secretary, you can also choose to be in research. Some of you can choose to be in publishing. Have you heard of permanence? Have you heard of permanence? Permanence has been doing very well and has won Healthcare Excellence Award for the past 5 years. It was established by a pharmacist over 40 years ago. You can also be in that area. After being successfully registered as a pharmacist, again, let me emphasize that you have opportunity to compete favorably. Everybody is doing well today. You can also compete to be there, and certainly you will make it. All that you require is due diligence and ensure that you follow the steps required of you in the course of your growth. Let me state that there are no limitations to where each of you can get to in life. Are you prepared for that? Are you prepared for that? Certainly you will succeed. However, pharmacy, like I said, is a noble profession. I will provide you with prospect practicing in different fields. Having listed the field, what I want from you again, for purposes of emphasis, don't look at the fact that you have opportunities in various areas, and then you choose to pick one, abandon it, and go to another one. Maybe I want to approach this speech, not what you are seeing there. I wouldn't want a situation where you choose to be in the community for 5 years, you abandon community pharmacy, you want to come to academy, you want to leave that and go to hospital. No. Life, of course, requires patience. Once you do a particular career that you have passion for, take note of the fact that it takes time. So, but be rest assured that if you are consistent, if you continue to seek guidance and you follow due diligence, certainly you will get to the peak of your area of. Do you hear that? Do you hear that? So, as you were also told earlier, the PCN, when you are in practice, it's expected of you to continue to undertake your mandatory continuous professional development program. This is for purposes of ensuring that you keep learning new things in the field of pharmacy. And let me emphasize that the continuing education mandatory continuous professional development program is not a program that is peculiar to Nigeria. It is a resolution of the World Health Organization for all health professional endeavors across the globe. And of course, we happen to be the first professional regulatory agency in Nigeria to start after the maiden health summit and directives of the Federal Ministry of Health in 1996. Let me, at this point, also inform you that the council, the PCN, found seriously at professional misconduct in its entirety. So you are advised to refrain from any act of misconduct, as this will be treated with all the seriousness it deserves. Kindly note that the PCN has provided for the establishment of an investigation panel, as well as disciplinary tribunal, as mechanisms for handling issues of professional misconduct. It is my prayer that that will not be your portion. Can I hear amen? Please keep away from the register and board syndrome, which has great potential to tarnish the image of pharmacy and bring the profession to ridicule. Similarly, you are advised to refrain from all forms of dishonesty in your practice lifetime. As pharmacists and frontline health workers, you are expected to be at the front line, offering professional advice, as well as intervention on drugs, whilst working with other healthcare professionals at all times. You have extensively about the need to have a collaborative practice, especially with this company for during the times of public health emergency that we recently had in COVID-19, as well as the diphtheria outbreak. The rest assured that every contribution we make at those critical times will definitely impact positively in overcoming those challenges. There are new areas which, of course, the Nigerian pharmacy world practices, experiences, and one of those, of course, has to do with the issues of vaccination as well as immunization. And I would want you to exclusively in this area. There are new areas with great opportunities, and we are already rolling out programs for pharmacists in this area. I want you to grab them, and of course, it will position you to effectively penetrate in those new areas and even to boost the global health, public health, in terms of public health emergency. Once again, as I conclude, I congratulate you. I congratulate your parents and family on this occasion of admission into the practice of pharmacy profession. Your taking an induction into the profession of pharmacy today does not take you from further guidance by your parents. This is supposed to be a wise counsel that today you have left school, but not and shall not put you in a position that you no longer need the guidance of your parents. The rest assured that these are individuals you will continue to do, not only in your practice lifetime at pharmacy, but to continue to seek guidance and counsel as you go through the school of life. As an advice to new graduates, I wish you had that you should not fill your career with abandoned projects. These are spoken earlier. What I mean by abandoned project is a situation whereby, because you have myriad of opportunities, you want to touch on everyone, and then you abandon one after the other and go into another one. It's indeed like a waste of time and can be categorized as abandoned project. The rest assure that you seek guidance, pick that which pleases you, that which is your passion, go through it with patience, and I can assure you, you get to the highest level. As such, please try as much as possible to avoid abandoned projects. In essence, what you should do is make proposable changes in life to complement your experience. It does not mean you cannot make changes, but in making those changes, make sure that you are convinced. Make sure they are proposable changes. And I think with that, you should be focused on your target and wait patiently for your reward. It is my wish that you have a memorable and mutually satisfying experience, like practice experience. You are welcome into our world. You are welcome into the world of pharmacy. Thank you, and I congratulate you. You are welcome into our world. You are welcome into the world of pharmacy.
Please, I will appreciate the registrar once more, please. May I invite the Dean of the College of Pharmacy to present the inductees to the registrar. Another please.
Will the pharmacy graduate please stand and remain standing? Dear registrar, the following 101 pharmacy graduates have been found worthy in character, and I present them to you for the doctor.
Thank you. Do I have a graduate all standing? Are you all standing? Sorry, I don't have that. Are you prepared to take this vote? Do you individually have the oath certificates? Do you individually have the oath certificates?
Yeah, you can see it.
Now, we will go this way. As I mentioned, I expect that each of you will mention your name as an individual that is taking this oath and who shall be binding. I mean, on whom this oath shall be binding. Are we clear? Maybe we are not clear. Can we confirm it? Can we confirm it? Okay. So you are safe. No, but I'm not convinced that you are safe. Are you told? Can I have your left hand up? Now let's go. As a family. And I want to hear it loud. As the farmers. I vow to serve humanity and support my profession ideal and commitment. I shall be guided in all dimensions of my life by the highest standard of human conduct. And accordingly, we perform my service and with devotion, dignity, discretion, and honor. I shall apply the full measure of my knowledge, skills, and abilities to improve the health and well-being of all those I serve, and place their needs above my personal interests and consideration. I shall treat all those I serve equally, fairly, and with respect, regardless of gender, religion, regardless of gender, race, religion, culture, or political beliefs. I shall protect the confidentiality of personal and health information entrusted to me. I shall maintain and improve my professional knowledge and competence throughout my career. I shall support the advancement of knowledge, skills, and failure of practice in pharmacy. I shall be committed to nurture the future members of my profession. I shall use all opportunities to develop collaborative practice with all healthcare professionals in my environment. I shall not use my knowledge of drugs, diseases, and medicine to cause injury to humanity. I shall sustain my dignity and respect for human life in the course of my practice. In taking this oath, I honor those who supported my development as a parent and committed myself never to act in a manner that is contrary to this vow. It is with solemnity and honor that I freely and publicly taking vote. Congratulations.
Please, round of applause, please. Newly local policies, can you appreciate that? I cannot very new. Thank you very much. Moving on, we're going to the next item on the agenda, which is the presentation of provisional registration certificates to the graduates and the PCI card price certificate to the fresh graduating students. So quickly, in our meeting, I will here at the university. We are going to present the fact. So our very distinguished guest speaker for this event. The person of pharmacy chief, who will allow you. Okay, so before that happens, I want to invite the vice chancellor to present the fact. First, to register, pharmacy council and the pharmacy plan the other. Next is the presentation of plan to the distinguished guest that promises should be held by the vice chancellor. Please put your hands together for me, please. Please, I will follow our partners, please. Thank you very much. Next is also the presentation by our very Vice Chancellor to the special guests of honor for today's events. May we have a round of applause? Can we have a round of applause, please? The total guest of honor for today's event is Francis Felicia. We need a round of applause, please. Thank you very much. Thank you very much. Vice Chancellor, so moving on, I want to invite please permit me at this moment to invite the registrar council council of Nigeria to outstanding. They will start. I also want to invite the dean, Professor Marco, the college of pharmacy to be decided. So the graduating class of 2022-2023 of the find out how I have to with the registrar and the deputy. We are going to do that freely. Freely, we are going to do that freely. Thank you very much. Okay, so we have other meeting about cases. Yes, something like our close people. We have other we have other rights. We have other spiritual. We have other
What I mean, here, government, and they have guidance in this world of everything, and practically here in the if you want to, I think it's here in the world of you have all the guys here, as opposed to have a different and the thing, we have a code that values here, the government, the common system of Nigeria, the global economic development. The demand and the need of the farmers, if you are in the hospital, if you are in the people.
The guest speaker. Must be there is also here. The guest the regular consultants of the family, whether you are a fellow, I am going to conduct the different areas. This award goes to immediate happiness and joy. The government with the multiple the GPA of all the These are all comprised of the river and us. The class will be divided in Please, we have this word in my city. But strongly the United Pharmacy or the business financial rights for the community students in each department. Something is something was because the next service of our settlements and analysis technology. Other territories. Thank you very much. Please, we have to invite other guests to speak. But they will not come to represent the power. And these are some of the agricultural activities. They do not have to have it. Whereas each of the business services students are getting a cash of government power. The next concern should carry something with and that is for but for now, I can also see of 6 Please, also emphasize that the very distinct festival of the occasional initiative power and turning out staff items of the power and visible. Yes, is powerful. I will represent the power. Almost all the people see here for 4.59. We also get to the pipeline of 100,000. All the things that are these are all when you are not talking about the rights of the when you are aware of something and close for the so the next slide is so subject quality around student without student alongside this particular certificate is a practical of which we have I want to take another day. Thank you very much. Next is talking about our Thank you very much. All right, now he's ready to do it now. Your responses will be likely to be our things that the next today, but the target for wait. With the level of what you need right now, we need to see the you sorry of the level of the thank you very much. I have reached out to the end of the meeting. However, I have this very important announcement to make. All the graduates are expected to submit the first copy of signed pharmacist certificates, as well as the photocopy of the certificate of provisional registration. So this are the points of submission of completion ground. Please. That will be done at the dean's office. Please, this is very, very important. A signed copy of the pharmacist certificates, as well as the photocopy of certificate of provisional registration at the dean's office. Do not forget to do that. Thank you very much. Also, I will ask you by that's every of which will be very secret on your system. This is very similar money. The registrar council of Nigeria sees until this event is declared closed. No one is expected to leave the hall. And this applies to all the graduates. Thank you very much. Moving on quickly, I want to invite our very special guest of honor for today's program. I want to Alicia, the one
Good afternoon, everybody. I am happy to be here, and I am sure you all are happy to be here. Having said that, I want to seek indulgence for the kind of existing protocol. Please allow me. My dear colleague, welcome. Welcome to the board. God bless each and every one of you. There is not really much I can say because the guest speaker, the registrar, the vice chancellor have said it all. It just happened that maybe along the line, we did not have the main thing. So I will just do a little summary. And the first of this is, as one of the men of honor, you must promise yourself to be focused. It happens to be the first admonishment I will give. Be focused. The registrar mentioned that. You see, the cost of pharmacy trains we will be with us that you will say. You fit in any aspect of expertise in the world. I don't want to start naming your family, your colleagues, old and young, that are not practicing pharmaceutical, chemistry, pharmacology, or whatever. But they are giants in other aspects of endeavor based on this primary basic training of farmers. And so, because if you choose an item to put in your life, do it well. In IT, they are there, just like our island and be. In authorship, they are there. Some of you may remember Cyprian places. He was the pharmacist, but he wrote fine books. We have a whole lot of others. And then the second thing I want to talk about is I will pick teaching here. Now I know the professor anything or food. Now I know the professor, and that brings me to your dress sentence of pharmacy to teach out beautiful for the girls and fine for the men. So we don't have to talk. Next. He puts you up there. He puts you up beyond, actually, by the time you start talking. You have what? Dress well. Be honorable in anything that you do. As families in society, community, or anywhere, you are about to first that any client, you can call them clients, will talk to. If you happen to be in whatever community you find yourself in, and you are introduced
climbing the staircase, gentleman, man with a certain, please stand up for that. The Union of that, when the vice chancellor was to talk, he said he whispered the witchcraft that every student did not laugh more than what they have done for the dean, they will publish okay. That is a term for what it is. And he also said for the past 6 years, we have never had any problem. He has coordinated the student and the staff very well. We have never had any problem. The king of the address speaker, thank you so much for the speech. Members of the IKB, thank you very much for coming here. On behalf of the parents, and I think, as also saw the line, they choose me to speak on behalf of the parents because they know I'm a pharmacist. The Benedict University, as they discovered the premium and leading private university in Nigeria. They have done endorsements that take time. The registrar is here. If they have not performed very well, the registrar will not be here to conduct this endorsement continue to the time. Please applaud yourself. Generally, we pharmacists, we said the pharmacy profession is the best profession in the world. Pharmacy profession is the most important profession in the world. And I will give you one example. That's what I'm very. You see the course you took today? It took some time before you finish. And all of you signed the law. I pray a lot of us make mistakes. And the lives will learn to do that thing. If your doctor is in the theater and make a mistake, it kills one person. If you're a pharmacy, to the company room or to the production unit and make a mistake, it kills several thousands of people. So you have to be very careful. I wish you the best. I wish you the best. You are going to the world.
behave very well, behave as pharmacists, behave as pharmacists. Everything has been done for you by the school and your parents. Don't disappoint us, don't disappoint us. And God will be your guide. I wish you the best of luck. Thank you. Please, somebody give a round of applause. Before I will read all the variants and guidelines, to the other policies, of the the director of health planning research and practices, licensing, and also the Indian Partnership of Society of Nigeria, and that's how the government will have to do it. The government of the director of the I've been informed by the Professor of France that coming the next day without updating this individual, but you know that happened to be the lives of the graduates today. And that is the next department of the different department of the College of Pharmacy. Sadly, we from our own way, we don't know what we will have we have the department clinical pharmacy, the friend, who said the lot of other works we have, they have the department pharmacy, all the very much and the event of our next regulation. Quickly, the identifies to the city, one of the game. For the interest, the representative of the graduate student, our agricultural speech for I don't know about that. Please, I will have to do that.
Good day, being here, esteemed college members, my beloved family, supportive friends, and my fellow guests. It is with great honor and gratitude that I stand before you today on this momentous occasion. Your presence here today is testament to your amazing support and encouragement you have provided us throughout our journey. Then walk. If you can't walk, you have to do it. Being part of the strategic spread essence of our journey and the resilience we have shown to reach this milestone. Standing before you all, I am filled with these emotions. We have all worked tirelessly to reach this significant milestone. Our dedication and commitment has brought us so far. The path to becoming a pharmacist is not an easy one, but our perseverance and persistence has failed. We should be immensely grateful to God and proud of our accomplishments. Throughout our journey in college of pharmacy, we have learned initiatives of production of medicine, the art of patient care. We have witnessed the power of of healing and the impact our actions or inaction make on people's lives. It wasn't only the textbooks and lectures that shaped us. It was the late 1930s, the youth project, the moment of triumph and peace that brought us together. We became supportive students for one another. As we embark on our individual path, let us remember the importance of integrity, empathy, and dedication to our children. Let us strive to make a difference in the world of commerce. Permit me to express my immense gratitude first to my Creator, my King, my Father, my Provider, my Sustainer, my Reverend. Thank you, Lord, for coming before me, for us. We never have done without words. My deepest gratitude to our great institution and our lecturers, who have guided us to their knowledge and wisdom, their dedication to our education and the human family. Every member of staff of the College of Pharmacy and institution at large, I say, depending on what we would achieve greatly. Congratulations on the last of 2023. God willing, I will need it. This is the 2023 we will achieve in the end for. Thank you all. Thank you. God bless you all. I would like to invite the immediate past president, to join me to present the award of appreciation to our dean.
Because God who was not only he was the Father, was our fighter, and we love him, sir.
All right, thank you very much. All right, my team, please kindly confirm that the financial performance of our work. The same way you have to the center. Please listen to the voting all the private and faculty from people for signing certificate as well as a certificate, the photocopy of the certificate of provisional registration. So the DPS are one of the system of the country, and that is your daily office. Please don't forget to do it. the photocopy of this document. May I at this point invite the next class of 2022-2023 into application of every grant of 2023. Our environment, we thank you once again. Without you, this investment will be possible. We say very thank you to you. I will also invite you to support and take on after this investment. But I feel a very good event to that. Thank you very much. Quickly now, the registrar, the University of Africa, I did the background for the group of friends. There are about him.
The Vice Chancellor, sir. Distinguished guests, ladies and gentlemen, but more particularly, our Sierra farmers. On behalf of the Vice Chancellor of Condolence, President Moye, PEFS, I extend my heartfelt gratitude to each one of you for gracing this momentous occasion. The 13th fourth decade and induction ceremony of pharmacy graduates of our great university. We are truly honored by the presence of our esteemed guests, parents, the faculty, the members, and inductees, and all well-wishers who have made this event a resounding success. First and foremost, a profound thank you to the guest speaker, pharmacist, Dr. Paul, that has been an elder statesman by all means for your insightful and inspiring address. Your words have not only resonated with us today, but will continue to guide the inductees in their journey in the years to come. And thank you more importantly for your very generous donation to the inductees. A special appreciation goes out to our representative, the Pharmacy Council of Nigeria, represented by no less personality than the registrar himself, Pharmacist Brian Ahmed, and indeed, we appreciate you for the critical role you play by adopting the graduates into the noble professions of pharmacy. Your commitment to the success of the University of Ghana is indeed deeply appreciated. Our gratitude extends to the special guest of honor pharmacy, Patricia Odaro. Your esteemed presence added glamour to the event, and we thank you for your good mercy and your best to the students. I'm sure that you were well taken. So I think faculty, members, and staff, we express our heartfelt thanks to you for your presence. We thank our dear parents in particular, the guidance, well-written, friends, who have traveled from far and near to attend the very important occasion. Finally, but most importantly, please join me in thanking God for making this event such a wonderful success. As we conclude this momentous day, let us carry the spirit of the university forward with pride and renewed commitment to excellence. Thank you and have a wonderful afternoon.
Please, shall we give another round of applause for our before the closing prayer, I want to inform us that there will be a group photograph at the entrance to the law auditorium, just once we ready to place now. We're going to have a group photograph with the Register Pharmacy Council of Nigeria, as well as our English guest speaker and the principal officer. When that is done, all the inductees will also join in that group photograph. Please make sure you are a part of this. May I now, at this point, thank you once again for your presence here at this occasion.